Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. I just want to take a break from all these patients to talk about some cancer news and some medical news. This week it was reported Tuesday in the Wall Street Journal about pelvic exams. Many of you have heard about pelvic exams. Women have experienced, most likely, pelvic exams. And guess what? The American College of Physicians released a set of guidelines saying that healthy women don't need regular pelvic exams. Wow! Yippee-yi-yi! I think most women will be happy about that. The professional group made its recommendations. This is an article by Angela Chan in the Wall Street Journal. Made its recommendations after examining scientific research from 1946 to 2014 that studied the effectiveness of the pelvic exam, which has been long part of a woman's health checkup. And, quote, they found, said Molly Cook, a member of the committee, quote, we found that the exam is not particularly good at detecting important disease, such as early ovarian cancer. It can fool a physician into thinking she has an abnormality. Once you notice, will require further investigation. The guidelines were published in the Annals of Internal Medicine, the physicians group that represents internists who specialize in diagnosing and treating adult diseases. Now, the American College of Obstetrician and Gynecologists, that's the group of gynecologists in America, which represent doctors in those specialties, said that women should consult with their health care providers about having a pelvic exam. They said the procedure is not evidence-based. That means there's not evidence to do it that's good. They said, well, maybe you should have it because it can bring to light issues such as sexual dysfunction and incontinence. The American College of Physicians said pelvic exams don't reduce mortality. They can lead to false alarms in up to 3% of women. They cause anxiety. They cause discomfort for many women, especially for those with a history of sexual trauma. Dr. Cook stressed the guidelines were only for routine pelvic exams, and for women with abnormal symptoms, they still need to get checked. So we've got two groups of doctors, both agreeing routine pelvic exams do not need to be done, but if you have symptoms, you need to get checked. If you haven't had a pap smear, you need to get a pap smear. So pap smear is usually part of the pelvic exam. Pap smears do need to be done. Pap smears are screening for cervical cancer, and we know that pap smears have led to a marked decrease in cervical cancer in the United States and actually worldwide. So it's overall good news for women. You don't need that routine pelvic exam, but you need your pap smears, and if you have symptoms, please come in or see your doctor. Do it because it's the right thing to do. And there was also news this week that the head of J.P. Morgan, Jamie Dimon, has a throat cancer. So it's reported, this is in Bloomberg News, Dimon's cancer has a 90% cure rate with chemo and radiation. He's 58 years old. He plans to keep on running the United States' largest bank by assets while he undergoes chemo and radiation. Radiation is, of course, high-energy X-rays that help kill the cancer. Usually chemo is given like cisplatin once every week to every 3 weeks for sensitizing the cancer to the radiation. Most people will have some sensitivity of their throat and mouth to the symptoms, but with radiation, and for this man as well, his prognosis is excellent. He said, Mr. Diamond said, his prognosis was excellent and the cancer was caught quickly. The cure rate, we know it can be up to about 90%, so most likely he is going to be cancer-free. Nothing's guaranteed, there's no absolutes, but most likely he's going to be cancer-free after treatment. Now, the oral pharynx, the area where he reported having the cancer, the oral pharynx is the area of the back of the tongue, the roof of the mouth, the tonsils, and the back wall of the throat. And about 70% of the cases in America are actually caused by human papilloma virus. Yes, it's that same virus that's causing cervix cancer in women. What are the causes besides human papilloma virus? Well, smoking and excessive alcohol are main contributors. Now, Jamie Dimon said he wasn't a smoker, but actually, according to a book written about him, he was a smoker while working at a commercial credit company in the 1980s before he quit, and he encouraged other executives to do the same, according to a book called Last Man Standing by Duff McDonald. So there's about 27,000 cases of throat cancers a year and about 6,000 deaths, which means that about 80% of all patients are cancer-free. What are the signs of a throat cancer? Well, you can have a sore throat or a lump in the neck. It can start in the tonsils or back of tongue and then spread to the neck. And if it's untreated, these nodules can grow. Obviously, they can grow. They can even take your life. So if you have lumps in the neck, again, we'd encourage you to come in. If you have lumps anywhere in your body, we'd encourage you to come in and get checked out. Just staying home is not a good strategy. Staying home, if it's cancer, will allow the cancer to just keep on growing, and we know that you want to live and be treated in a good quality way to not suffer and hopefully be one of those 80% successfully treated people. So that's the story of Jamie Dimon, the head of Morgan Bank, the biggest bank by assets in the United States. And we had another man with a throat cancer. This is a man with a totally different story. Yes, he had a cancer of the tongue. He had surgery at a big hospital in Manhattan in 2011. The cancer at that time was 1.7 centimeters, so almost an inch at the back of the tongue. So it's a pretty good-sized lump in that little area. He's a 63-year-old man, married with 4 children. He had this lump, and he had blood, and he had pain, and he went to a hospital, and the surgeon cut it out. But where he cut left what's called positive margins. Positive margins means they cut, and there's cancer cells up to the margin. So, in fact, a cancer surgery should remove the entire cancer, never touching the cancer. It should go around the cancer. That's how cancer surgery should be done if it's going to be done. Of course, we compete with cancer surgery, doing radiosurgery and non-invasive treatment. This man had surgery, but the surgeon cut through the cancer. Oh boy, you might say, and I agree, oh boy. Because when they cut through the cancer, just like if you slice a loaf of bread, you can leave crumbs out there. Slicing the cancer and cutting through the cancer can spread the cancer. Well, he had a second operation by a second surgeon, and now he's back to get worked up. And as I said at the beginning of the show, we're going to talk about all these patients who have come this week, and they're coming because they're not comfortable with the care they're getting. So we staged him up with 2 tests and a physical exam and a history, and he got copies of all this pathology from 2011. And guess what? Sad to say, the cancer is back in the base of the tongue. Now, usually people who have tongue cancers receive radiation because the tongue is very vascular and cancer cells can travel fast in the tongue. He wasn't referred for any treatment after the surgery, which is strange. He saw two famous cancer surgeons. He is back. I talked about all the options, which can be surgery, chemo, radiation. You can choose no treatment, that's your choice, but he's a pretty vital 63-year-old man. So his cancer is back by both PET-CT scan and by MRI and by physical exam. So he's deciding, and he'll be back this week to give us his ideas and questions. And of course, he has my phone number to call, which makes it easier for any patient to deal with a serious condition. And yes, it's cleanup day, and another cleanup case, which is shocking, really shocking, and a black man, who went to the hospital in the 5 boroughs. He wasn't doing well. He lost 50 pounds of weight, and he was weak. He went in April to a famous hospital, and they worked him up. They found things wrong, but they didn't treat him. The strangest thing. They didn't tell him what they found. They didn't give him copies of the paperwork. They didn't repair what was wrong. They sent him home with no guidelines in April. He comes to me now. We got him staged up now. He has cancer cells in the bone. He has a rock-hard prostate on physical exam. And the prostate is so enlarged, it's obstructing the flow of urine from the kidneys. Now, if the kidneys can't get the urine flowing, the urine is very harmful to the kidneys and actually can destroy the kidneys. His creatinine, which is a measure of how the kidneys function, and normally it's around 1, and on dialysis it's 10, in him was near the dialysis range at 7.1. And because his kidneys weren't functioning, his potassium was very elevated at 6.3. So it's life-threatening. Life-threatening. And his hemoglobin, which is a measure of the red blood cells, which in most of us is around 15, 16, and this man was 5. So he lost 2/3 of his blood, his kidneys were ready to shut down, and his potassium was elevated enough to cause arrhythmia, even death. So we took emergency measures to get his kidneys opened up, to take care of his hemoglobin, to take care of the cancer in the bones. All this information was provided to the patient. All these options were given to the patient. And when I spoke to the patient, he understood clearly what the situation was. He had copies of the reports in his hand. And unlike in April, when he walked out of the hospital not knowing what was going on, here he knew everything that was going on, had all the paperwork. We took action. We make recommendations to get him on the road to recovery, which is, I think, where everyone wants to be, on the road to recovery, or even better yet, recovered. So what a difference a day makes in this man's life. Getting worse, worse, worse for months, comes to us, and in one day, we're able to turn the corner and get him on the road to recovery. And speaking of the road to recovery, we have 2 voices. They're going to talk to you about how you, if you need, may wish to choose our road for the road for your recovery.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is